Go ahead, Gabrielle.
And you also want to press *1.
Yes. Okay, there we go. There we go.
Okay.
Great.
Very good. Let's begin. Welcome, everyone. I am Gabrielle Hilberg. Thank you for joining the Preventative Health webinar series on digestive wellness, what has gut to do with the brain and health, and alternatives to colonoscopy. Tonight we are fortunate to have Christine Roche, digestive health expert and clinical nutritionist, with us. Christine's background includes 25 years in healthcare, including 10 years at Stanford Medical Center. She has studied and worked with leading physicians in preventative health in Europe and the United States, and she's bringing to us the latest information on how to keep your digestive system healthy and vital. She's the author of 2 books and has worked and taught at Stanford Medical Center and at clinics nationwide. She maintains a private practice in Palo Alto and works nationally via Skype and telephone. Her specialties include functional digestive testing, alternatives to colonoscopy, heartburn, constipation, IBS, colitis, inflammatory bowel disease, ulcers, diarrhea, food sensitivities, and gluten intolerance. So welcome, Christine.
Good evening, Gabrielle, and everyone listening tonight. While preparing for this exciting webinar, I found that I have so much important information for all of you that we will be doing the webinar in 2 parts. Part 1 will be today. We will cover an overview of the digestive system, how the gut influences and affects whole body health, including our brain, the role of the gut immune system in health, why gut bacteria is so vital to the health of our brain and our bodies, what happens when the good bacteria is disrupted, intestinal permeability or leaky gut issues, and the importance of testing, functional digestive testing, to find out the real status of your digestive system, as well as the pros and cons of colonoscopy. In part 2, on August 26th at 7 p.m., we will focus on what you can do for optimal gut health, what to do when your gut's immunity is compromised, the role of food allergies and gut permeability, gluten intolerance, a very hot topic these days, how to assess bowel transit time, practical tips on how to measure your own stomach acid production, and what enzymes you need for optimal digestion.
Yes. Very good, Christine. So why is the healthy gut or digestive system a key so important for health and prevention of disease?
What does gut have to do with our brains and overall health? Absolutely everything, Gabrielle. Hippocrates said all diseases begin in the gut, and so many times when we have digestive symptoms such as constipation, bloating, diarrhea, we also have symptoms in the brain of depression or brain fog, poor memory, inability to focus. So actually, the brain mirrors this change of the neurotransmitters that has to do with things going wrong in our gut in terms of both enzyme secretion and other factors. So we often find when we're really tired or depressed, or we have irregular bowel movements, it looks like there's a real connection there between the gut and the brain and the whole body. And in 21st century functional medicine, we now realize that the body operates as a whole, that communication patterns appear in an integrated system where one area of the body, such as if you have asthma or allergies, or you're not sleeping well, or you have headaches, may very well be the reason. The reason may be that your gut is unhealthy.
So many people who have suffered for years from hosts of different symptoms, and doctors say they can't fix it, and it seems to be all in your head. And so some of these long-standing problems that are kind of chronic are not being addressed. Can you explain what the problem is? Why is it so difficult for doctors to find out what is the origin of these things that you have just listed?
Yes, doctors are trained to identify dis-ease by where it's located. So, for example, if you have asthma, it's considered a lung problem. If you have acne, doctors consider it a skin issue. So the traditional medical system, the reductionistic system, looks at pieces and not the whole picture. The old way of defining and curing illness is very useful when we have a trauma, such as an accident, or we have a broken bone, then standard medicine shines. Or if we have if we have a surgery that we need, like the wonderful advances in heart and brain surgery, that's what it's for. However, when we come to these lifestyle related to these symptoms that we're talking about, depression, anxiety, headaches, the different autoimmune diseases, all of these doctors are being trained to look at the leaf of a tree. So just picture a physician standing, looking at a tiny leaf, and functional medicine, the system that I have been training under in my branch, looks at the roots of the tree. So we're realizing now that as a whole ecosystem, for example, people with anxiety and depression have serious gastrointestinal problems, so that they found that thousands of people with anxiety actually have GI disorders such as ulcerative colitis, irritable bowel. Teenagers have, turns out with many with depression, have actual gut permeability, and people with migraines and fibromyalgia all have an intestinal component, as you can see on the slides. So it's very significant.
So
yes.
It sounds like you are saying that the digestive system has to be brought into the picture to understand many, many different ailments that people are suffering from. Is that what you're saying?
Yeah, I'm saying that even if you have never had any digestive complaints, everything is connected. So the center of connection is the digestive system. Digestive issues account for more than 100 million doctor visits and billions in healthcare annually. And it has to do with the fact that this is the root of so many of our health issues.
Now, I know that you went to see Dr. Rao and his Paracelsus clinic in Switzerland. And just a quick word, why do you find in Europe different approaches to this holistic approach?
I found, actually, Gabrielle, the Europeans pay a lot of attention to autism and some of these behavioral issues. And what I found in Europe is that because the government pays for health care, the approach is one of looking at how the body is functioning before serious disease or illness happens. So Dr. Rao of the Paracelsus Clinic in Switzerland would definitely say to everyone, without good intestinal health, you do not have good immunity. His research found a close correlation between healthy gut bacteria and the absence of cancer or degenerative disease in the body.
Wow. So tell us more about this connection between the gut and depression.
Well, if you have ever suffered from depression, you know that treating it can be a trial and error experiment to make the right meds fit your particular brain chemistry. Unfortunately, most patients that I've seen in clinics over the last 20 years say my depression meds just do not work. I try so many of them, and it just is not helping. So a 6-year study of 4,000 people showed that 75% of the patients still had 5 or more symptoms while on the medication for depression, including sadness, insomnia, and even suicidal thoughts. Dr. Rao says that depression has to do a lot with an imbalance in the gut. So here are the findings. There's a reason why the drugs do not work. Antidepressant drugs target your brain. But depression is a full body experience. It goes hand in hand with the stomach and the nervous system. The answer lies in treating your second brain. And the nutrient that's best way to do this is probiotics.
So a lot goes on in our gut.
Yes.
And, because we typically don't feel our gut, it's hard to imagine the complex processes that are going on. But are you saying that a lot of the hormones, the ability to feel good, all that is related to the gut?
Yes, our digestive tract produces 96% of our serotonin and feel-good chemicals. And it's a two-way street because one of the things I'm showing here on the slide is the complexity of why we sometimes feel butterflies in our stomach if we feel nervous, because the gut has a mind of its own. And basically what I'm showing here is the enteric nervous system, which has its own neurotransmitters, and the brain and the nervous system, they basically are connected by the vagus nerve. So I'm showing a slide here of that and about the gut-brain axis of how all of this is connected through the vagus nerve, and that's why, it has a nervous system by itself. So when you're thinking about something, all of a sudden you feel the butterfly. And the studies have shown that good bacteria and probiotics lower those anxiety levels by raising the GABA levels in your brain. And lower GABA levels are linked to insomnia also. So the gut regulates the acid-base metabolism. So it's very important to know, how the gut is affecting your health and all of those things together in terms of that. So this is really a key in terms of understanding and really knowing that the gut-brain balance, is one of the keys that we're really looking at. And I just want to make sure if people could raise their hand if they're seeing the screen. The reason I went back to this is I just had a message from the webmaster that some people may not see the slides. So I want to make sure that you're able to see the slides. Please raise your hand if you can see the slides.
Christine, I can see the slides, but the first slide, but it's not moving.
Okay, all right. So I'm going to go ahead right now. If you will just excuse me just a moment. I'm going out of the keynote slide. I'm going to come right back in with the slides, and we're going to be just a moment.
And let me say something to the attendees. If you are on the phone and you don't have a computer in front of you, so you will not see the slides, we will send you a link within the next 24 hours, and then you can go back and look at the slides on your computer. So don't panic right now.
Thank you. I want to make sure that you're able now to see slides moving. Gabrielle, are you able to see that?
Not yet.
Okay. It should be in just a moment. It is showing that the slides are actually on the screen according to what I'm showing. Excuse us for a moment to be able to rectify this, and we will continue in just a moment. I want to make sure that that is correct. I am moving the slides right now. Okay, I think I know why this is, why it was happening. So let me just go ahead right now, go back to this. Okay. Yes, now it should be back up. If you would please confirm that. It is up now.
Yes.
Yes, okay. So I'm going to go ahead now and resume.
Right.
About the brain and the empiric nervous system. Can everyone see the picture, Gabrielle, and the
Yes, I
gut-brain
do.
axis?
Mm-hmm.
Okay, great.
Right.
So having butterflies in your stomach, the anxiety has an impact. So now please go ahead, Gabrielle. Just,
Yes. So it sounds like if our gut is not balanced and healthy, every organ of our body, all aspects of our health, physically, mentally, and emotionally, are affected.
Yes, that is correct. And the gut regulates so much of our immune system. 80% of the immune cells, it influences the production of hormones. It's the underlying cause of all autoimmune diseases such as MS, lupus, Hashimoto's thyroiditis. And it influences, as I was saying, the unconscious. So every aspect of our body is affected, and we don't really know what a happy and healthy gut is and how happy and healthy we can feel within our digestive system. So let's take a trip now through the digestive system and just look at what actually happens there. And I just want to remind all of you that we're going to go back to the probiotics in just a moment, but I would just like to look at right now, what does the gut tell us about how does it work, what happens with our digestive system and so on. So I'd like to begin by just pointing out that the digestive system has the esophagus, the stomach, the small intestine, the large intestine, and the colon. There is also the salivary glands, the gallbladder, the pancreas, and the liver. There's a lot of different systems that are part of that. And think of it as a 16 to 23-foot tube that runs from your mouth to the anus. And it turns food molecules that our cells can use for energy, maintenance, detox, growth, and repair, and helps to run our metabolism, protecting us from infection and foreign substances. So to be healthy, you must be able to break down your food properly, absorb it through the intestinal lining and into the bloodstream, and assimilate the nutrients into the cells.
Okay, so I can imagine that each part of the digestive system can break down and cause problems in the rest of it.
Yes, exactly. Our digestive system is like an irrigation system. A large source of water gets narrower and narrower, finally getting water to each tiny portion of a field. If the water becomes blocked upstream, the plants wither and die. So the unblocked flow of nutrients fully digested is crucial for health. And the cells really need that food for growth and repair. Now, what I find in my practice is so many people are unable to produce the right enzymes. For example, remember what it felt like when you're smelling a lemon. It really starts there, just looking at the food, the wonderful juices in your mouth. It starts activating the salivary glands. And when you sit down to eat, this is crucial. Your digestive enzymes start to get activated in a totally different way. When we're standing or moving when we're eating, what happens? We block our enzymes that are so critical for breaking down the nutrients. I find so many people actually eat on the run, right? It's very familiar, and that's the very thing that would actually block us from properly secreting the enzymes and digestive juices we need.
So it's like eating a sandwich in the car. Doesn't sound like even that would be a good idea.
No, as a matter of fact, most of my clients say, why is it that I start getting heartburn the moment I bite into the sandwich? It's because at that moment, what we're doing, the body thinks, okay, I'm getting ready to move. I'm getting ready to do something here. I can't focus on secreting these enzymes. It's too much.
Yeah, and so heartburn and acid reflux then indicates something about insufficient in the stomach.
Yes. What's interesting is, we're a nation of Tums and acid reflux consumers. Yeah. Most physicians, every client I see last year was on some kind of a proton pump inhibitor, which is really, it's an antacid that they're like Prilosec. And Prilosec is the very thing that is very useful in a crisis when you need to stop stomach bleeding or inflammation, but if you take it more than 30 days, it will actually stop your body from making all of the digestive juices and enzymes that you need for breaking down your food. So people with heartburn can often get with more severe issues in the gut because they're no longer absorbing their nutrients. People with lots of gas are often fermenting their food, and they don't not have the right amount of stomach acid. They have insufficiency in that. Food sensitivities lead to fatigue, skin issues, brain fog. They can lead to a lot of problems, and gut permeability, which we will talk about later, can cause gut and systemic inflammation as food particles can pass through a permeable membrane, and we'll discuss this a little bit further on.
Yeah, so absorption and elimination problems of the digestive system affect all other systems, right? And the organs in our body. Can you share more about this?
Yes. Well, the 80% of our T cells, our lymph immune system cells, lay in the intestinal membranes. And so there's these millions of little lymph follicles that are the carriers of the immune system. Like an army, the lymph cells control the bacteria and keep the body healthy. And so what happens is that, for example, cancer has a major immune deficiency component. And according to Dr. Rao, he said he's never seen a cancer patient with a healthy gut flora. He said he's verified with thousands of patients that all cancer patients have significant bad flora overgrowth in the digestive system.
And I think later on in the seminar, you will help us understand how we can find out what imbalances we might have, even though we don't have any symptoms right now, and then what we can do about it.
Yes, this is the purpose. It's just like in the Rao Clinic and all over the area and in functional medicine, we look at, what is it specifically that is going on with your system and know much more in detail, and then what you can do about it. For example, people with MS, cancer, colitis, Crohn's, all have stool bacteria that's 100th or 1,000th of what they should have. And if the gut bacteria is not adequate, you lose an important part in the battle of the cancer, against cancer. So in order for the body to recognize cancer cells or any invader, the immune system has to recognize it, go after it, and this is very much dependent on the gut bacteria.
And so you talk about the good gut bacteria, and then also there must be then some bad gut bacteria.
Yes. Well, what I want to just emphasize for the listeners is that your healthy digestive system is full of 500 to 1,000 species of beneficial bacteria that amounts to 3 pounds of your total body weight. And these bacteria are essential for making vitamins, all of the B vitamins. They also regulate the metabolism of cholesterol. They detoxify the poisons, help us to maintain a normal pH balance, and produce the short-chain fatty acids, which we need to fight inflammation and for our immune system and absorb our nutrients. So they actually produce anti-inflammatory cytokines. If you can imagine little gut Pac-Man in your whole system eating up the inflammation. So these healthy bacteria, our microbiota is a unique imprint we have. It's unique to you. They comprise 99% of the total amount of DNA in your body, and they live in the digestive tract, the skin, the eyes, the airways, the blood, mouth, and vagina. So we have billions of these things and hundreds of trillions in the colon.
So I imagine it's important to take care of these healthy bacteria so that they can do their job and take care of removing the unhealthy cells.
Yes, this is the key. It's so very important. It's similar to brushing your teeth, flossing, bathing, and hopefully smiling and laughing each day. You produce several ounces of these every day and eliminate several ounces of them.
So you talk about the microbiota as the fountain of youth. Can you say more about what you mean by that?
Well, it's a colossal fountain of youth because it affects the rate at which we age. If we're able to have the right balance there and we have mostly the good bacteria and the good microbiota will protect us, will protect every system of our body and actually slow down the aging process. Imagine a football field. This is your intestinal membrane and it's covered with bacteria, thousands of species. And very important also is before birth, you receive your pre-digested food from your mom, and the digestive tract is sterile. But babies, the way that babies are exposed to bacteria through nursing and breast milk is crucial because breastfed infants in studies show have the increased numbers of the good lactobacillus and bifidobacteria. So it's very crucial in establishing their lifelong immune response is set up at that time in infancy.
Yes, I attended a seminar on healthy nutrition and the brain, and the presenter talked about that if you are not getting those specific bacteria through the breast milk, that really never in your life can you bring these bacteria into your gut. And so you miss out on some valuable helpers inside your gut.
Yes. And this plays an important role in fighting infectious disease and being in the front line of the immune system for the rest of your life. We will be talking about, though, how you can actually find out how to test what's going on with your own bacteria and what you can do about it.
Yes. So I heard that healthy gut bacteria play another important role in our bodies. Can you talk about the manufacturing and absorbing of food and how we can affect a healthy digestive tract?
Yes. Well, we need this bacterial layer to help us metabolize and convert, for example, the plant oils, and olive oil is an example, into essential fatty acids so that our brains can function at their highest efficiency. That's just one example. It takes this particular, if you eat, let's say you've just eaten fish or olive oil, and it converts it into essential fatty acid. It's necessary, and also it helps us manufacture all our vitamins and improve the normal bowel transit time, which in Seminar 2 we're actually going to talk about how to test that. But it's very important to have a more good peristalsis, good movement of the food through to the abdomen and absorbed from the small intestine into the large intestine. And these also help us detoxify environmental toxins. And this is the key, is that, when we have improper bacteria, we have improper digestion, as I'm showing on the slide, which disrupts the communication between the gut and the whole body and can actually lead to pretty serious autoimmune disease, autism, ADHD, all the things we've talked about. The bad bacteria produce toxins that trigger the immune system, and then it causes inflammation. So in a sense, they help us with anti-tumor, anti-inflammatory, and all rhythms of the body are affected by that.
Now, you include sleep here in your list.
Yes, because sleep is influenced by the brain chemistry, and when the bacteria is out of balance, the brain chemistry is altered, and we are no longer able to make the compounds and the hormones we need for good sleep.
Wow. So I imagine there are two sides to these bacteria stories, the good side and the bad side.
Yes, we call this dysbiosis. Dysbiosis means not living together in harmony. A good neighborhood gone bad. The bad bacterial neighbors have taken over like weeds in the garden, and the good bacteria are no longer able to thrive. So what happens when you have an overgrowth of the bad bacteria, it's usually because there's not enough of the good bacteria to keep the bad out. This dysbiotic happens because we can no longer protect ourselves from these microbes. So the bad dysbiotic bacteria produce toxins and inflammation that is released not just in the digestive system, but throughout the whole body. So the brain is alerted to inflammation. we see a variety of both physical and mental issues as a result of this inflammation. We can have serious cognitive impairment, even obsessive compulsive disorder. And we see this whole situation with this bad bacteria going, when they overgrow, we really need to take measures to stop that because it will cause systemic right inflammation. It's a major cause of all autoimmune disease. The research shows in functional medicine and in standard medicine, they have found that arthritis, lupus, and the early stage of colon and breast cancer, inflammatory bowel disease, irritable bowel syndrome, eczema, fibromyalgia, food sensitivities are all contributed by these bad bacteria. So it's a vicious cycle.
So when I feel a little bit of arthritis in my finger, it also means that there's really inflammation there. And if I have inflammation in my finger, I might have inflammation in my brain too.
Exactly. And it is caused, one of the factors is both the permeability issues, food allergies, as I'm showing on the slide, affects the immune system very significantly. And so that's, yes, you may have you have inflammation in the gut and in the brain as well.
So what causes this dysbiosis?
So one of the factors here, what causes this imbalance in the gut, is that it's caused by, number one, medications, antibiotics being one of them. The latest research shows that the American child receives antibiotics 4 times a year at the age of 1 already. So we are in a nation of giving antibiotics to the point even beyond. They found that physicians write prescriptions for many reasons not necessary, and they need to give probiotics. Pro means for life, and anti means against. So while the antibiotics kills the harmful bacteria, they also kill most of the beneficial bacteria in the gut. For example, you always want to take a probiotic as soon as you even start an antibiotic, and then studies show that it can take 6 months before you rebuild the flora. So actually what we're looking at is that when you kill off all the good bacteria, you have a barren terrain in your gut, which is vulnerable to commensal and bad bacteria to settle there. And if every doctor and hospital gave probiotics to help the body replenish, we would thrive again. So it's medications, stress. When you're under stress, the body just uses up those bacteria so quickly, so it gets depleted. Environmental toxins, other factors, the standard American diet, low in fiber and high in sugar, alters the environment in the gut, allowing the bad bugs to take over. And as I was saying, also, and any medication you're on, acid blockers alter the gut bacteria. Steroids, all of them, and environmental toxins. We have so many toxins now and heavy metals that those definitely damage the normal function of the gut and prevent absorption of important nutrients, and food allergies cause inflammation and malabsorption of nutrients.
Now, I want to go back for a minute, and you mentioned the superbugs. Can you speak to that and perhaps give us some advice what to do if we do have to go to the hospital for surgery or something? What's your advice?
Yes, well, this is very important. Right now, the studies show that one of the greatest risks going to a hospital for surgery is even more than the procedure at times is being infected by a superbug. And these are bugs that have grown out of control because of what has happened with us killing off so much and such an overuse of such stronger and stronger antibiotics that people don't have the resistance anymore and they thrive because our gut is a barren terrain. So C. diff, capital C, capital D-I-F-F, is an infection which is prevalent in every hospital now in so many places that can cause life-threatening diarrhea and other very serious symptoms. So how you want to protect yourself if you go into a hospital or a clinic even is by having a very strong gut flora and large amounts of the good probiotics. Then
prior to going into the hospital?
Prior to going in, for months sometimes if you can, but definitely for weeks. Because they found that people who have the strong gut flora on the tests, were the ones that where they just went in. It cannot take hold because they have this strong millions and billions of the good bacteria to really protect them from that taking hold.
Great. I want to take a moment here to let the attendees know that Christine is offering an incredible gift to all who are listening. To receive the gift, please go to Christine's website within 24 hours of listening to this program, and you go to www.lightlivingprogram.com, and you click on the is there a button for attendees for the seminar?
Yes, it says webinar attendees, click here on the home page. There's a paragraph. It says click here for the webinar attendees.
And so what the participants are receiving is a free gift of a 30-minute evaluation of your personal digestive health. That can be in Christine's office in Palo Alto or by phone. Is that correct?
Yes, by Skype, phone, or in the office. If
Okay.
they're at a distance, yes.
Great.
And also there is an offer for 50% off the evaluation, which we're going to talk about. Yes.
Yes. So, Christine, I have heard Dr. Rao say that leaky gut syndrome or intestinal permeability is the key underlying cause of immune disease and brain inflammation. Can you tell us more about what is meant by gut permeability?
So gut permeability occurs when the tight junctions of the intestinal membrane are compromised and become widened and permit large undigested compounds such as toxins, bacteria, undigested food to actually cross this membrane through the opening that has occurred because of gut permeability. And in just a moment, I'm actually going to show the participants a movie of how this happens. So selected symptoms of leaky gut are confusion, lots of brain symptoms, as you can see on the slide, mood swings, nervousness, anxiety, gas, bloating, skin issues, indigestion, food allergies, constipation or diarrhea, asthma, fibromyalgia, systemic inflammation, pain, migraines. These are just some of them. And usually permeability is related to malabsorption and dysbiosis and impaired intestinal integrity because the lining. Now here we see that. Can you see it clearly, Gabrielle? Yes.
Right.
This is a movie of a healthy gut. You can see how the membrane below is pretty tight. The junctions are tight. And so the bacteria, virus, food, it just goes by. So now I'm going to stop that and show you the leaky gut movie. Look at this. Look at how these are the permeable membranes in the intestine. The junctions have opened, those tight junctions, and they're allowing food and bacteria and viruses to cross there, which means it goes into the bloodstream and creates an antigenic reaction, can create a strong allergic reaction in the bloodstream, which then has to do with the awareness of, oh my gosh, what are we going to do? Because it is, for example, what we found is that through a lot of the research that is going on is that when people have Hashimoto's thyroiditis or, when they have lupus or MS, every single person tested positive on the gut permeability test. They had the drugs they took, the stress they had, the combination caused these junctions to become permeable, and they had an antigenic whole body inflammation response.
And so somebody who doesn't know about the leaky gut syndrome might just feel like, maybe I'm getting older or I'm not having as much energy and digestion is not as good as it once was, but not understand the severity of what is really going on.
Yes, and I think the key is, Gabrielle, the most important key is that when you have any inflammation, such as, if someone comes to me last week, a client came and she could not move her hands or her feet, she's in her 50s, she has already inflammation in her limbs. And so by checking an analysis, I do a stool test in the office that checks for gut permeability, and we also have several tests that check for that in various levels, we found that sure enough, the inflammation was already systemic-wide because she had this permeable membrane in the gut, and this can be healed. If you catch it at any stage, it can be healed and reversed.
Okay.
And we'll talk about that in part 2.
Yeah.
Specifically,
so tell us about what testing is being done today to assess the GI, the health of the GI tract in regular medicine.
Yes, this is very important, Gabrielle. I'm so glad that we're looking at this together, because what happens is that what we're doing now is we're actually doing functional testing in the GI tract, as opposed to looking at, what happens when we have an imbalance in the body, and we're just, when a client in the standard annual medical physical, you receive a stool swab to look for the presence of occult blood coming from the colon. And if the stool blood shows occult, it's a stool test, that swab, that all that you receive once a year, if it shows occult blood coming up from the inside of the colon, you already have colon cancer. By the time you get this result, it's just so late in the game. You're already, once this is positive, you have cancer. The test is only to measure disease, not how your digestive system is functioning.
Yeah,
However,
and so, go ahead.
Yes. So what the difference is that in the standard medical testing, we look at assessing, end-stage disease. However, as a nutritionist and preventive health consultant, I measure how your body and GI system functions. So that means I look at your gut bacteria, what type you have and what type you're missing. You have dysbiosis. Are you digesting and absorbing your food properly? What enzymes are present and what are missing? What's your gut immunity score? And are you making these anti-tumor and anti-inflammatory markers? So I highly recommend this comprehensive digestive stool analysis, which you can do in the privacy of your own home. It's picked up by FedEx from your home. And in 2 weeks, it shows you a complete picture of 24 analytes of the functioning of your digestive system.
Yes, and again, here I want to point the attendees to the special offer number 2 that you find on Christine's website, www.light, I always get it wrong.
LightLivingProgram.com.
Very good. Okay.
Yes.
And it's a 50% off the comprehensive digestive stool analysis, which is a value of $300. And so this allows you to get your own profile, as you're seeing in the slides, that it can be determined what exactly the condition of your colon is like.
Yes, it shows you exactly what is going on with you, very specifically. So we're going to start, because you're getting such a good picture, and it's, it's a non-invasive test. For example, here's an example of a client that it is showing on the left her a beneficial flora, and that's a rating from 1 to 4. So, for example, she has NG, no growth of the lactobacillus species. So she had a lot of issues with not having enough nutrient absorption. She was not able to digest and process her food. So this slide shows you the beneficial flora. It shows you exactly what you have, the imbalance in the yellow, and she did have some very serious Klebsiella pneumoniae at a 3+, which is a dysbiotic flora at that level that has been shown in research to be a contributing factor in MS, rheumatoid arthritis, all autoimmune disease. So 10 years down the road, if she has no symptoms, you can feel totally fine. You can have 2 or 3 pluses in the middle or dysbiotic flora. If that is never handled, that's a major factor contributing towards specific inflammatory and degenerative disease. 1 year later, after she was on the remedies that were needed for this, so when you take the test, you will learn exactly what you need to improve the functioning of your GI system. She tested with no dysbiotic flora. The right side was completely clear, and her bacteria on the left were significantly improved. So it's about, you look at the bacteriology, you're looking at every single aspect of the health of your body. You're looking at all of the bacteriology, all the mycology, every single aspect of health of your body. That is very, very important. For example, it's going to measure also the culturing the different things. It's going to measure the particular aspects of whether you're digesting, absorbing your food. It's going to measure the number of enzymes you have, whether you need enzymes. It's going to measure the secretory IgA, your immune system score, your SIG-A score. It's going to measure how much immune system support that you need, and it's going to also measure the function of your pancreas and and how much inflammation there is, and it measures occult blood. So you get your stool swab test with this test, but it shows you 24 other factors, the functioning that you can improve in the gut.
Yes, and I have taken the test myself about 6 or 8 weeks ago, and it's wonderful in terms of you take it in the privacy of your own home, and you get such specific results as to what is really needed in your system. So rather than just going to the health food store and picking any kind of digestive enzymes or probiotics, you can be very specific about what each person needs.
Yeah, because just knowing in general what to do is not enough. In other words, so to get rid of the bad bacteria, this test gives you the specifics of what type of bacteria, what type of probiotic is customized to you. And, it's my guess when you can test and find out before costly symptoms develop, and that this affects every aspect of your life. So like, for example, with the secretory TA, it shows you exactly your complete picture of your immune system and what you need to do to improve it.
So what about other standard medical tests like colonoscopy? Many clients are concerned about the risk of colonoscopy, and can you tell us what is the latest and best information on alternatives to colonoscopy?
Yes, Gabrielle, this is very important. What I find is that, when I was looking at the research, that colonoscopy is a very expensive, we know it's a, $2,500 to $500 invasive procedure, and we need to understand that colonoscopy is limited to looking for disease. It does not show the digestive system how it's functioning before very serious disease develops. So it is certainly useful. For some people, there is a reason for doing that if they have a long-term history of colon cancer on both sides of the family. However, what my clients find, a lot of them, is that the prep can be so challenging because it's not only the magnesium to eliminate the bowel, to remove all your bowel, they put in preservatives and flavors and colors. So my clients all say, by the time I do the prep, sometimes I just can't even do the test. I'm feeling so poorly. So, it's challenging. It is certainly something that you need to decide with your physician whether it's appropriate for you. However, the latest is that I have been researching a new DNA test, which is just coming out, that I'm having in my office this next month. It's a stool panel that is a DNA measure from Germany. They have in all over Europe. They have this later DNA test that's going to come in the United States at some point, and it is going to show us whether or not colon cancer is 97% accurate. So what we're seeing now is DNA tests. There's the colonoscopy, which is only to diagnose cancer, precancerous polyps, which in some cases may or may not become cancerous. And the research shows that it's primarily looking for disease. It does not show you, you could have the worst bacteria overgrowing and no gut immunology. That will not show up. So it's a screening test for disease. And if you do the DNA test, for those listeners that are interested, please take advantage of the special offer that I have, because I will tell you at that time in a consultation about that DNA test. So some listeners who have it, you just want to find out, what is my risk factor? What this test shows you is where you are in the developing stages towards colon cancer. In other words, 10 years before, Dr. Rao would say, before colon cancer shows up, there are certain inflammatory signs. He catches it with that DNA test before tumors even would show up in a colonoscopy, way, way before. So when you do that, so that is really the exciting news, is that we now have that German DNA test that tells us so much information, about that. It's really wonderful.
And, it's like I appreciate so much how much you have traveled and explored and studied and opened your mind to new things, and then you bring us the results of all your research and what you have learned. And the idea that you can measure our gut permeability and give us a clear idea of how my personal situation is and how I can help myself to prevent diseases that are developing. I think that's just so exciting to hear that we can take our own health in our own hands.
Yes, exactly, completely. And I think what happens is that, when you can test for gut permeability, you can test for these different things that we have talked about. And then what's very exciting is that you can reverse the process to the point where you are regaining your entire health, the whole health of your body. You're regaining all of those things together. So it's very, very important, and also, since food is medicine, we work together with the most important aspects of what it is, that is so crucial in terms of the food we eat, what supplements customize to you. It's very specific customization for that. That's so important.
Yes. And people on the webinar who can see the slides are now seeing again how you get on Christine's website, www.lightlivingprogram.com, when you click on webinar participants, click here, you can go to special offer number 1, a 30-minute complimentary digestive evaluation. That's by Skype or in person, a value of $100. And special offer number 2 is 50% off the comprehensive digestive stool analysis, which is a value of about $300, which gives you the direct information of what you need. And then, Christine, you told me that you have put some personalized kits together so that people get exactly the kind of supplements and probiotics that they need for their own particular situation. Is that right?
Yes, I have. And what I've found is that, many family members and friends have had this low gut immunity show up on the test. Almost everyone has a compromised, the immune cells are compromised, and also they had inflammation, and everyone was saying, what can we do? So I did extensive research in the United States and Europe to find a solution. And after much searching, I have developed now a customized intestinal healing and repair kit that contains the best of U.S. and European and Canadian products for your optimal health and outcomes. So by working with an intestinal rebuilding system and kit, I'm putting all this together in a way that is specifically customized for you so that you know exactly what will help you, to regain your optimal gut, brain, and whole health. And it's coming also, I found, from these particular remedies that are not even available yet in the United States.
So I was not familiar with these silent, what do you call them, silent allergy.
Yes.
Can you say just a little bit more about
that? Yes. What happens is that when you have a food sensitivity that's silent, it's like a smoldering fire in the digestive system, which then becomes systemic over time. And what can happen is, for example, we all know when you have an allergy to a nut, a Brazil nut, and you swell up, that is an acute allergy. But these are low-grade silent sensitivities that have no symptoms or indication. I mean, you might have a little bit of brain fog, you might feel not that well, but most of the time, Dr. Rao found that, like 80% of people had some kind of food allergy that became, after many years, a contributing factor to the permeability and to the systemic inflammation. So when we talk in the second part of this webinar, we're going to talk about how to recognize, identify these particular ones on August 26th, Tuesday, August 26th. Please mark it on your calendar at 7 p.m. And of course, we'll remind you that you can have silent allergic reaction to the food, to different foods without ever knowing it. And this can be a major drain on your immune system and affect how your immunity is functioning.
Well, I'm looking forward to that webinar, which ties right into the basic understanding that we are creating today. And maybe by that time, several of our attendees have gotten their personal digestive analysis evaluation done so that you can even understand better what Christine is sharing in the webinar on August 26th. Shall we open it now for questions?
Mm-hmm.
Okay.
Yeah, if the rep assistant, please, can unmute the participants who would like to raise their hand to ask a question.
If you'd like to ask a question, just click on that yellow hand on your control panel.
Looks like Carol.
Carol, you're unmuted.
Okay, great. Hi, Christine. Thank you. I really appreciate your presentation. It was very informative. But could you go more in depth on how important is this comprehensive digestive test?
Yes, thank you, Carol. It is very important. It's crucial for us to know what is going on before, we end up getting to the next stage in terms of the imbalances becoming symptoms even, or if you have symptoms, it's even more crucial. And the reason for that is because just knowing in general what may be going on, so many times we think, oh my God, I can just go to Safeway and buy a probiotic. But it turns out that most of those over-the-counter probiotics do not contain the right amount of the bacteria, nor do they contain the right species of what we need. So if we want to get rid of the bad bacteria, we have no symptoms. Most people that come to my office say to me, yes, I want to test the bacteria because I know I'm tired, I don't feel it. But generally speaking, we could have severe dysbiosis in the gut developing an overgrowth of this Klebsiella, and just to get rid of it, we need to know how much, and we need to know how much of the good bacteria we have. So we cannot know the cause without the testing, or even if you have symptoms, you can rectify them. Most medications, of course, is like with the proton pump inhibitors, Prilosec, or even with Paxil and SSRI, you're just suppressing the symptoms. The purpose of the testing is to identify so you can really heal at the core. You can go to the roots of the tree and ask, what nutrients do I need? For example, the test shows you how much pancreatic enzyme you have, and if you have enzyme or gastric acid insufficiency, and what type of enzymes would you need. So it's a complete picture. It's so much more, informative when you really know specifically. So it is really, otherwise you feel like you're just, hitting with throwing darts at different things. But it's just crucial for really knowing what's going on. And then 6 months later, you will retest, and some people retest 3 months later. And one client even found that she found early stage inflammation that she could take care of through this test that would have really become a serious problem. So I've found people with the inflammatory marker. We can identify inflammatory bowel disease, 5 years before it would become a critical situation. The early markers are already there, and we can rectify that. So yes, it's just very, very crucial to really know specifically what's going on.
Okay, I see. So with the test, you can basically create something that would be individualized for me.
Yes, it's very. This is it.
What's happening within my body and the chemistry and health issues.
Yeah, that's right. It is.
Okay. Okay.
Yeah.
Thank you.
Thank you.
Yes, Carol. This is Timothy, and I just received my test results, and I've had severe skin issues going on for over 15 years and thyroid issues for the last 3, and now prostate issues. And the medical community looks at all 3 of them separate and can't come up with anything. And the digestive test basically revealed the source of everything to me. So now there's a program that I can go on to take care of everything.
Thank you.
Great. Thank you.
You're welcome. Thank you, Christine, for sharing the test with me.
See, so yes, so we have so many factors and so many exciting new remedies from Europe and from all, also from Canada. There's a lot of new things that are part of my intestinal kit, and here we have also many great remedies. But I'm wondering if anyone else has any questions, anything else that they would like to ask, or just raise your hand so we can unmute you, or anything to contribute. Let's see if there's anybody else. And it is really important as we're waiting for that, to realize that how our gut is such a major, it has so many responsibilities in our body to keep everything working properly, and, so that it's really helping us to identify things early on before things really get out of control by, different things, that how it tries to get our attention. And I think headaches also, I'm just going to keep talking a little bit while people decide if they have any other questions, but I know that headaches and fatigue is one of the things where the gut is trying to get our attention in many different ways. We found, of course, also the whole brain and all of that. And what's so exciting about next month is that we're going to go into all of the specific foods and the things that you need to do in different situations, the different things that are available to you to actually use the remedies that we have available, and really talk much more in detail about these different things of reversing these issues, but also for a healthy gut. What are the things that are crucial for a healthy gut? Healthy digestion. We didn't really have time today to go into the digestive enzymes, but I'm going to talk in depth again on Tuesday, August 26th at 7 p.m. Please join us for this intensive part number 2. Gabrielle, do you have anything else you would like to add? Otherwise, we're going to just, thank you for attending.
Complete for today. And what I feel so excited about, Christine, is that you're taking the guesswork out of things, and we don't have to wait until we have clear symptoms of some disease, some breakdown that alert us to something is off, and that we can be educated and take our own health in our own hands. And thank you so much for having done all this extensive work. And I know that sometimes, it's hard to know what conference you are attending, because you're going to so many things and listening to what is really at the frontier of the preventative health approach. And you are bringing it all to us so beautifully. So I want to thank you for all the efforts and the work and the excitement that you have put into researching this area and helping all of us.
Thank you, Gabrielle. And I'd like to thank Timothy and Gabrielle and everyone that has been supporting this webinar, and especially the people listening. I very much look forward to seeing you for the second part, and on August 26th. And thanks again for attending.
Okay.
Good night.
Very good. Take care.